I'm Dinesh Suman. I come from Indian Spinal Injury Center, New Delhi, India. And my talk has been sponsored by my institution and thankfully to the ICS Travel Fellowship Award. Our spinal cord injured patients have problems in their follow-up. We also have problems if they don't follow up. We try to find out, could we use WhatsApp as an effective tool in clinical practice? We all know what happens if they don't follow up. Greater risk of complications, adverse effects on quality of life. E-health, with the use of web, it was envisaged we might be able to help it better. But the ubiquitousness or prevalence of web and its usage in Indian setup is not far-reaching. Telemedicine, call it the use of electronic information, was not being helpful because of the lack of an effective tool with which to use it. Then came the mobile phones, which bridged the gap. Smartphones getting into every hand made the entry of telemedicine very useful and very practicable and ubiquitous. Audio-visual communication became very easy, bilateral. In fact, there has been a survey in 2011 by Franco which said even most of the doctors were using non-standard, non-medical tools in their practice. Smartphones offer new opportunities because they are easy to use, they're portable, they're simple, and they're an ideal tool for quick referencing, learning, and good communication. WhatsApp Messenger, when it started off, has taken the world by storm. Starting from 2009, it has over 130 billion users all over the world. The number seems to be increasing. Even in India, about 40% of population by 2015 and 16, and even more after the introduction of Geo, it is reaching up to about 60-65%. WhatsApp Messenger is a very useful, easy to use communication tool, helps people to stay connected at no extra cost. What you need is just a mobile phone and an internet connection. Entry into medicine is becoming very, very effective, which is good for low and middle class countries and rural countries. We are interested in its use in hospital care and particularly in medicine. A lot of workers have found that it's being used and is found to be effective in a number of areas of medicine. And the spectrum involves physician to patients to work, other health workers to nurses and patients themselves as variety of forums where it could be made useful of. Medical indications are very useful for chronic conditions, for ongoing care. Because what's very important to understand is that what happens to the patients at home is very important for the patient and for the doctors. And that's what we need to keep watch on, and smartphones allow us just that. And in terms of patients' benefit, it empowers them and makes them feel that they have help available at any point of time. Even when NHS went down this year, WhatsApp was available for doctors' help. Peer communication is also very useful at this platform where people can talk to each other and find support. So we decided to see whether this kind of an application is useful in Indian scenario in our spinal cord injured patients in particular. We envisaged a small study where we put in our specialty nurses who are trained in urology, and we made a team. They access patients and asked them, with their consent, they were asked to fill in a questionnaire, show their willingness, and share their queries and concerns. And at the end of the year, share their experiences. 840 patients, of which 720 patients agreed to participate, and 600 continued throughout the year. They use this for appointment counseling, for sending them reminders. What is important to see here is 60% of the patients found it easy, comfortable, and reliable to be on WhatsApp and talk to their doctors. 40% found to come the conventional way. We used to receive about 20 queries every day amongst the 4 of our healthcare workers, and 70% of the queries were during the regular working hours and 30% during the off hours. Majority were elective concerns. A large number was, about 8% were emergent concerns. Most common queries were related to catheterization difficulties, fever, hematuria, and episodes of autonomic dysreflexia. Message was in the form of mainly in the text message, but other forms of scanned copies of reports, pictures, samples of urine, samples of blood stains, questionnaires, or other direct talk for other forms of communication. We were able to help people in 72% of cases resolving the concerns, and in 30% of cases helping them to find the nearest help available, such that 85% found the service to be very useful for their requirement. One small limitation that we restricted the study to our follow patients and no new patients, because these are the patients whose records we had and we knew them by their profiles. So this was just to share a small first ever study on the use of WhatsApp in spinal cord injured from India. It seems a promising system which helps to provide instant messaging technology to provide distance care to the follow-up patients for whom disability, limited movements, and lack of support is a major concern. However, there are future concerns with which I'm sure in times we all shall work on to improve its effectiveness, to improve how it is administered, to improve the safety profile, and to resolve some of the ethical concerns. There are certain problems like anytime message. It's not an easy thing to handle throughout the day. We are still not sure whether to make it a paid or a free service in Indian scenario. Some people definitely make misuse of the privilege. I'm sure with better learning and better teaching, they will learn to make better use of this. And every hospital, every team has to decide who are the people who should be communicated in the order of approach. And I'm sure medical legal concerns according to the local scenario will need to be worked out. WhatsApp has huge potential, but there are certain barriers in terms of user friendliness, in terms of computer literacy, cognitive impairment, and physical impairments. We need to work on those issues. Telemedicine, WhatsApp, mobile phones are tools to provide the comprehensive quality of care, and I'm sure with these, at the end of the day, if we are able to improve the life and health of our patients, the purpose would be achieved, and patients won't need to come all the way, and they could approach their WhatsApp doctor for easy solutions. Thank you so much.
Thank you. So we have a time for a single question, should anyone have one. Now, normally when you innovate and start using these things, some healthcare manager bans it because it works. What problems did you encounter in getting approval for this to be used? Did you have any administrative barriers to overcome? WhatsApp, of course, is end-to-end encryption, isn't it, Diane? The NSA know all about that.
This is the end-to-end encrypted.
Yes. And were they happy about that?
Yeah, patients are happy, but hospital doesn't have any objection to our use of this. They leave it to the doctors and patients to mutually resolve this issue.
Please.
Yeah, it's a question, I guess, to both of you, because I can see it's, I mean, you represent different healthcare systems with different needs and different means. So I can see in one system is more inventive and more free to invent and use, and the other system is more organized and has more constraints in regulation and things. Do you feel that this will at some time be united and be able to provide help to all these patients that we've heard in all this, by all the speakers, that there is lack of services to those who need, and the communication with providers and those who know is not optimal?
Well, I'll tell you, in the U.S. is that we all systems now have patient portals, we're called. And what that means, and it's been regulatory, and what that means is basically patients can email me anytime. It's through a patient portal, whether it be their smartphone, their iPad, their phone, their computer, and I have to answer it within 24 hours. And they can go into their chart and find anything I release as far as tests or whatever. And that's now standard.
And you have a special system for that to ensure confidentiality?
Again, it's just part of our electronic records now, and we had to put it in place. And it can be abused, but it's actually worked out quite well.
So in Indian scenario where e-health system is not as developed as maybe in certain other parts of the country as they have, we find WhatsApp to an individual practitioner or to an individual department would be an easier thing to organize and handle and to serve their patients better. And definitely if we have an organized system, eventually all this will move towards the organized system, because at the end of the day, the safety, security, confidentiality and analysis and everything lies with the organized data gathering. Thank you so much.
Thank you very much. Thank you. We move on.
Okay, then.